Diastasis recti is the separation of the rectus abdominis, the six-pack muscles, along the midline of the abdomen. It's common and a normal part of pregnancy caused by pressure from the growing uterus and hormonal softening of connective tissue. While strong, forceful abdominal work is often discouraged, some core engagement can be beneficial, especially when focused on the transverse abdominis, the deep abdominal muscle that supports the pelvis and spine like a corset. Activating this muscle can help stabilize the abdominal wall and reduce further separation. Which yoga poses a student should do depends on the student's ability to engage the deep core correctly. For students with strong core awareness and control and no active diastasis, they may be fine continuing with poses like plank without modifications. But for others, especially those with weaker or disconnected core engagement or an active diastasis, poses like full plank or boat pose may lead to overuse of the rectus abdominis, increasing the risk or worsening of diastasis. Doming is strongly associated with diastasis recti. It refers to visible bulging or a ridge that forms along the midline of the abdomen, usually from the sternum to the navel, when pressure increases inside the belly. It often shows up when someone tries to sit up, twist, or engage their core, and the abdominal contents push outward through a weakened or separated linea alba. It's called doming because the tissue pushes up in a dome-like shape rather than staying flat or drawing inward. Most commonly, it occurs in people who have diastasis recti or in individuals who have poor core control or engage their abs in a way that pushes pressure outward instead of stabilizing inward due to over-recruiting of the rectus abdominis and lacking activation in the transverse abdominis. If doming is occurring, it is a sign that the core is not stabilizing effectively. This may mean the pose needs to be modified, a different pose is more appropriate, or the student may need more information on core engagement and alignment. Doming is the body's way of showing that there's too much pressure on the abdominal wall, and continuing without adjustment could worsen diastasis or cause discomfort. Deep back bends should also be approached with caution. Poses that stretch and lengthen the front of the body too forcefully, such as wheel pose, can place added strain on the linea alba, potentially worsening the separation. Back bending should be kept supported and modified with a focus on opening the chest.